A team of doctors, nurses, and respiratory therapists arrives this week to help Spectrum Health hospitals in Grand Rapids. This federal assistance is in response to the strain from having so many COVID-19 patients. Other hospitals in Michigan have requested similar help, including Mercy Health. 13 on your side's Elena Holland spoke with the chief medical officer for Mercy Health Muskegon. And Elena, what is it like at the hospital as they wait for this help?
Well, Juliet, it's pretty strained. Right now, Mercy Health Muskegon is treating 75 patients with COVID-19, putting it at 98% capacity. Now it's taxing nearly every staff member in the hospital who are already overworked. Pushed to the brink.
It's like a slow boiling situation that just won't go away.
1/3 of every bed at Mercy Health Muskegon is filled with a COVID-19 patient. Justin Grill,
It's strained.
is the chief medical officer. He is waiting on word from the state health department after the hospital requested help in the form of doctors and nurses from the Department of Defense.
Hey, we're in a tough spot. It's actually getting worse. It's not getting better. And hoping and hoping and hoping that maybe some help will come.
Grill says this is their 4th surge, and while last year's end of the year surge had higher numbers, this is hitting the hospital staff harder.
It was a notably different situation because everything had closed down. Everybody was redeployed to the hospital. The federal government had passed the CARES Act, which allowed for funding to make up for the holes that we had financially. This time around, all that's gone.
In the meantime, Mercy Health Muskegon is using team-based nursing, traveling nurses, and extending the ability of existing staff. But that has its own consequences.
It's difficult to come to work and be busy all of the time. It's difficult to come to work and realize I'm not doing as good of a job as I normally would be able to do because of the resource constrained environment that we're in. And then to deal with things like significant medical morbidity and death on top of that is truly a challenge for our staff.
About 80% of COVID patients in the hospital and 90% on a ventilator are unvaccinated.
So we know that the most effective way to keep people out of the hospital is vaccination. It works better than our medicines. It works better than the antibodies.
Grill is hopeful the federal assistance will come through, and a representative with the MDHHS told us multiple Michigan facilities requested the help, but teams are just not available at this time.